Hello everyone, I am Dr. Preeti Sharma, Senior Consultant Pediatrician at KIMS Cuddles Hospital, Kondapur, Hyderabad. I will be talking about how to take care of children with COVID-19 at home. So with COVID-19 cases increasing rapidly across the country, many children are being diagnosed to be positive either because of a contact or sometimes it is the children who are getting the symptoms first in the family. Most of the children, 90% of them will be asymptomatic or mildly symptomatic and can be managed at home. So first thing, if your child is diagnosed with COVID-19, do not panic. Few basic things need to be followed. If your child is the first one to have symptoms, please isolate the child. It is difficult to isolate a younger child completely. So one of the parents take responsibility of the child. Both the parents should not get exposed to the child. So either the mother or the father should be with the child. Make sure that the utensils of the child are kept separate and try to make the child use a separate bathroom than the asymptomatic people in the house. If parents are also having symptoms, then there is no role of isolation and the child can be with the parents without any problem. If the child has basic symptoms like fever, cough, cold, you just need to give basic symptomatic medicine. If you have paracetamol at home, use that. If child is getting slightly high fever, you can just go for sponging. One advice I would like to give to parents is to go for online consultation with your pediatrician right at the beginning so that you can be guided correctly. What are the warning signs, when you should go to the hospital, what tests need to be done. Otherwise, in majority of the cases, your doctor will simply tell you basic medicines for fever, cough, cold. Some children may develop some loose motions, vomiting, stomach pain, rashes, red eyes. For these also basic symptomatic treatment works. Some multivitamins, vitamin C may be prescribed to boost up the immunity of the child. But in general, nothing to worry, just give lots of warm liquids, keep your child well hydrated. If your child is older and will cooperate, go for steam inhalation and gargling. For younger child, don't force them for steam inhalation. Sometimes we have seen accidents happening because of the hot water. So it is not that steam is curative. Yes, it does help in COVID, but if your child is not cooperating, don't worry about it. Purchase a simple finger pulse oximeter to check the saturation of your child. You can do that morning and night, twice a day is enough. If child is sick, having high fever or severe cough, then you can check the saturation 4 to 5 times in a day. A simple tip for checking the saturation is make sure you use the pulse oximeter in the middle finger, which is the biggest finger for the children, and the pulse oximeter should fit in snugly. Make sure the child is not moving the hand and is sleeping or at rest when you are checking the saturation. You should see a nice wave. In some pulse oximeters you can see that a nice wave should form for around 30 seconds to 1 minute, and when the reading has stabilized, please consider that reading to be correct. In younger children less than 1.5 to 1 year, sometimes it may not be possible to get a good reading of saturation. So in that case, you need not worry about it. If the child is otherwise fine, feeding well, no fast breathing, no breathing difficulty, fever is under control, then nothing to worry in that case. Most symptoms in children last for 2 to 3 days. Rarely mild symptoms may extend up to 5 days. Rarely some basic blood tests like CBP, which is complete blood count, CRP, which is C-reactive protein, and X-ray may be advised. A word of caution, please do not go for CT scan for children. CT scan is done only for very, very sick children who are on ventilator or who are not improving as per our expectations. Routine use of CT scan is not good for growing children. It has radiation of approximately 100 X-rays. So unnecessarily, on the advice of some relatives or by consulting some general practitioner, please don't go for it. Similarly, other blood tests which you hear about in adults like D-dimer, interleukin-6 and other such tests are of no value in children. So unless a child is very critical or very sick, we do not go for these unnecessary tests in children. Do not use antibiotics irrationally in COVID. COVID is a viral, self-limiting illness. Antibiotics have no or minimal role. Definitely on day 1, just because somebody else used azithromycin or doxycycline, please do not give the same medicine to your child. Maybe if fever does not get better by 3 days, then your pediatrician may consider giving antibiotics. Some parents insist to use antibiotics. Please try and understand that antibiotics have their own side effects and they can make symptoms like loose motions, vomiting and stomach pain even worse for the child. So my take home message is just keep the child well hydrated, give good liquids, get in touch with your pediatrician right in the beginning, follow basic medicines and do not panic. So hope this helps you. Thank you.